With much of Michigan at a high level of COVID transmission, the CDC is urging the return of masks for many. Do we really know where we are on the COVID cycle? As Russian rockets rain on his homeland, one of Ukraine's most renowned writers comes to Detroit. And the push to get the menthol out of cigarettes. Today is Sunday, May 15, 2022, and this is Flashpoint.
Hi there, welcome to Flashpoint. It has been another very busy week on so many fronts. We're going to try to catch up on several issues today. We need to start this morning with the pandemic, which apparently hasn't gotten the memo about being over. It is getting rather tricky. We know the number of cases is shooting up again. What does that mean? If you take a rapid test at home and you test positive, that result probably isn't making it into the state tally. And right now with allergies and what some assume is a spring cold, some COVID cases aren't being revealed at all, even to those who have them. Now the CDC is urging a return to masks in many Michigan counties. We're going to talk about that this morning. Also today, the horrors continue in Ukraine, courtesy of Vladimir Putin and the Russian army. 14 million Ukrainians have been chased from their homes. 14 million. 6 million have left the country altogether. This week, one of Ukraine's preeminent novelists came to visit Detroit to talk about his new novel, which is about what else? The Russian invasion. I am delighted that Andrey Kurkov will be joining me this morning. And the push to get rid of menthol cigarettes. If that doesn't sound like a big deal, keep in mind tobacco is considered the leading preventable cause of death among African Americans. Back in the 60s, menthol cigarette marketing was targeted specifically at black smokers. And today, 85% of them opt for menthol, which uses a minty flavor to cover the bitterness of the smoke. Today, we'll talk about the FDA proposal for a menthol phase-out, all today on Flashpoint. All right, I want to begin today with a quick checkup on the pandemic. We know cases are on the rise, certainly many more, though, than are being reported. Hospitalizations are ticking up, too, and the CDC is recommending masks now in more than a dozen counties in Michigan. Very good to have with me in person Dr. James Baker, the Ruth Dowdone Professor at Michigan Medicine, and the man behind the Pandemic Pondering blog, and who we have turned to time and again on Flashpoint. Good to see you. And in fact, really good to see you because you revealed in your blog a couple of weeks ago that you had finally succumbed to COVID.
Yes, I wore my N95 religiously, except in my daughter's apartment, and it turned out she was positive. And I kept screening 3 or 4 days, and sure enough, I flipped.
Well, that's where we are right now for so many. We find that it's gotten very, very easy to catch it, and so many people are just kind of tired of all of the prohibitions. Is this our new reality, that you're just going to get it?
Well, the virus has become much more transmissible, and you know, intellectually, if you want to maintain yourself as a virus with more and more people getting immune to you, you want to be more transmissible, and you don't want to kill off your host. So the disease has also become less severe. But certainly, we're seeing tons of it out there. You know, whatever measure you use, there are lots of people that are coming up. 1 out of every 5 people that have the sniffles and come into the emergency room are testing positive now. Yeah. So that gives you an idea.
It does. We also hit a very sad, poignant milestone this past week. 1 million Americans have lost their lives to COVID. The overwhelming majority of them didn't have the vaccine, though.
Exactly, and we have a different population now. In 1918, if you lived to be 65 years old, you were pretty hardy. Now, many of these people are maintained on drugs, which have been very effective in suppressing their immune systems and helping them with disorders like arthritis, but it also makes them more susceptible to infections and more susceptible to bad outcomes from infections.
We can see from this CDC sort of advice that they would like to see us to kind of tighten down again. We've got people going to restaurants, going to concerts, lots of big group gatherings now, conferences and the like, things like that are back. Is it time for us to change behavior again?
You know, it's a hard question, and we're still in an area where we have much more information than knowledge, if I can put it that way.
Right.
We get sources of information from everywhere.
They're not the same.
They aren't the same, and we haven't distilled that down yet. But what we're seeing is that it's not unreasonable to be doing things and going out and living your lives. wearing a mask is not that big a thing if you're going to a large event. On the other hand, people aren't getting sick the way they were. We aren't having people in the ICUs. We're having people in the hospitals for sure. A lot of them are coincidentally found with COVID. They aren't really there because of COVID. But what we're seeing is that basically the disease is becoming as much an annoyance, certainly a concern for things like long COVID, but the acute illness, the bad pneumonia that we were seeing early on just isn't happening because of the immunity people have developed.
And I've said many times on the program, I remember reading the very first month that all this was described as a pandemic, the natural course of a virus is more communicable, less deadly, and that's exactly what we're watching play out. Let me ask you, though, about boosters. There are some people that are a little bit more hesitant on the second booster that's come around. They wonder how long are we going to be in a cycle of boosters, for one thing, but it also seems to, at least anecdotally, not have as long of an effect as we've seen on the first booster.
What we're seeing is two different things now. People have looked predominantly for antibody against the virus. An antibody is probably a good measure of your short-term infectivity, i.e. the likelihood of being infected at all. The good news is that long-term cellular immunity, which is really what we got from that first boost, is what tells you aren't going to get seriously ill or die from the infection. So right now, we are seeing a less effect. I mean, if you were going to Europe, for example, and being worried about being infected there and having to wait for a week or 10 days to become negative, sure, get that booster to prevent the infection. But I think what we're seeing is that new forms of the vaccine will probably be out there in the fall, and that's going to be the time to really go after the boosters in more of a yearly manner, I would guess.
It's gotten very complicated now. We know that the state gives us their data on Wednesdays. It's once a week, but it's gotten very complicated trying to glean exactly what we're supposed to take from that. As I said, cases are most certainly undercounted because of the way people are testing at home or not testing at all. But the other thing that we do know that hospitalizations are up, though not at the severe levels that you're talking about. Wastewater testing has become another thing that people are talking about. What are you gleaning and looking for as you look at the data?
That's telling us there's a lot of virus out there. And that's a helpful thing. In some ways it might predate, a surge in infections. But there's really a disconnect right now. And I think people have been focused so much on the bug, they forget the host, which is us. And we've evolved over this period of time. And if you get the vaccine, and now we're seeing people who are vaccinated and infective really have very high levels of immunity after that. So I think we have to remember that it's not just how much virus is out there, but how we as a human race are reacting to it and how we're handling it. And we're doing much better than we were 2 years ago.
Leslie, if among the unlucky who get it twice, what does that tell us for people who've gone through it yet again, and sometimes the second time's worse than the first?
It's telling us a couple of things. Number one, there are differences in immunity and immune protection between different of these isolates of virus, the different variants. So in fact, you could have been unlucky enough to gotten the original virus and now get one that's different enough that escaped it. But it's also telling us when we look at these people, almost always the second time they're infected is much less symptomatic. So in fact, there is some benefit from the earlier infections and from the vaccine.
Dr. Baker, really great to have you. You've been a terrific guide for us through this whole thing, and I know, unfortunately, we will still be in touch again.
All right. Well, I'll look forward to that.
You bet. Thanks. Dr. Jim Baker from the University of Michigan will continue with more on Flashpoint right after this.
The season's hottest patio furniture is in stock and ready for delivery during the outdoor living event from Allstate Home Leisure. Pools starting at $89 per month with 24 months no interest. Michigan's largest selection of hot tubs starting at just $49.99, only at Allstate Home Leisure.
know, but luxury is always in style. During National Kerosene Month, receive a rebate of up to $1,000 on timeless kerosene styles. Elevate your decor with sophisticated designs and remarkable quality, including carpets steeped in a century of kerosene craftsmanship, as well as kerosene's brand new luxury vinyl and elevated wood, offering beautiful wood look flooring that is better than nature intended. Don't miss your chance to live beautifully on kerosene, only at Independent Carpet One.
The season's hottest patio furniture is in stock and ready for delivery during the outdoor living event from Allstate Home Leisure. Pools starting at $89 per month with 24 months no interest. Michigan's largest selection of hot tubs starting at just $49.99, only at Allstate Home Leisure.
We were just on our way to a simple dinner. It's a 2-lane highway. The driver of the other car was heading at us, hit us head on.
She's extremely lucky. A horrific car crash, a trauma in this room, intubated, unconscious for weeks. Now,
I do think there's a bit of fate there.
it's a story that comes full circle.
Monday on Local 4 News Today and streaming on Local 4 Plus.
We have talked a lot about Ukraine on this program. As we've noted often, for many Michiganders, Ukraine is more than a foreign dateline. It is home. And that makes all the more timely this week's visit to Detroit by the Ukrainian novelist Andrey Kurkov. His works have been translated into dozens of languages, but he's also written screenplays, documentaries, children's books. He is a real tour de force. His new book is called Gray Bees, and it's a novel that centers on the Russian invasion of Ukraine. And Andrey, I'm so glad that you're here. Thank you so much for coming.
Thank you for inviting me.
Many people would look at your novel and think, wow, he hustled together a novel in 80 days. It must be a great frustration for you and many other Ukrainians because the West seems to think that this started 3 months ago.
Yeah, it's true actually. Ukrainian war, which started in 2014 after annexation of Crimea, was going on for 8 years, unnoticed and unreported. So what we have now, the new, much more cruel phase of the same Russian-Ukrainian war.
Yeah, I'm going to assume you've had a little bit of frustration that even goes back further than that. I was thinking just today, it was only about 8 or 9 years ago that the West stopped referring to it as the Ukraine and started saying Ukraine. And to call it the Ukraine kind of diminished the character and the sovereignty of the place. We talk about the Rockies or the Sahara. If we talk about the Ukraine, it feels like we're talking about a region rather than a people and a country.
Well, it's true, Ukraine was not taken seriously by many countries, not only in the States, but in other places too. But Ukraine is only 31 years old. It's a young state with a lot of issues. We had more issues than now, actually. We had ground level corruption until 2004, until Orange Revolution. But people were fed up and people changed this situation. And now, I mean, if there is a corruption, we are talking about higher business circles and higher political circles. But Ukraine is changing, and this is what irritated Putin, because he was losing Ukraine. He was losing chances to take it back, to make it Soviet again, which is to make Russian.
In fact, that being one of his main goals here, I know you believe that his actions may have the opposite effect. Whereas maybe you had a few more Ukrainians inclined to speak Russian, you think everybody is now going to be a little bit more eager to embrace what it is to be Ukrainian.
Well, we can say that actually Putin managed to create a Ukrainian political nation. Because, I mean, there were lots of discussions among Ukrainians, should we go for ethnic nation or political nation, etc. Now it's clear. I mean, Russian speakers, Crimean Tatar speakers, Hungarian speakers living in Transcarpathian region of Ukraine, they are fighting together on the front to defend the liberty and the sovereignty of their state.
Yeah. I always think that when horrible things happen, the artists seem to shed the heaviest tears. And as a novelist, it's interesting that your current novel, The Gray Bees, centers on the lives of ordinary people when war is swirling about them. Happens to be in Donetsk, which takes you back to the invasion you were talking about. But talk to me a little bit about your fascination with the way that, because that's been the most amazing part, I think, that has been so touching to many Westerners, is watching ordinary, everyday Ukrainians responding to this horror.
Well, I mean, I didn't plan to write this book, actually. I was provoked, even not by the war, because I didn't want to write something until the war is over. But what happened, actually, we had influx of refugees and IDPs from Donbass coming to Kyiv, settling in Kyiv. And I started meeting these people, and one of them actually told me that he goes by car to one village next to the front line. The village is almost abandoned. 7 families live there trying to work on the land. There are kids there in the families. They don't have electricity. They don't have shops, pharmacies, no social help, nothing, no authority,
nothing.
because actually this is the front zone. And so he was delivering them what they needed, medication, some special food or whatever they asked for. And this was when I thought about this gray zone, because gray zone exists in every frozen conflict. This is the strip of land between warring fractions positions. And in Ukrainian gray zone was the same length as front line until recently, until 24th of February. It was 430 kilometers, 300 miles. And the gray zone was sometimes 300 meters wide, sometimes 3 kilometers wide. There were dozens of villages with lots of people still remaining because, I mean, they refused to go. They didn't want to leave their houses behind. They didn't know what is happening outside. And there are still people there. It's not a gray zone anymore. Now it is occupied by Russia.
By Russians, yes.
Yeah, but I thought that there were already 200 books about the war in Donbass in 2017, and not a single one about civilians which were caught up in this war. I wanted to give voice to these people, and this is why I wrote the novel.
In this case, a beekeeper, for those unfamiliar, but you'll want to check this out. I'm curious about the way that a Ukrainian look. We've all marveled at the response of not only the Ukrainian people, but the Ukrainian military specifically. Vladimir Putin clearly thought he was in for about a 7-day war here, and it was a huge miscalculation. But have you been surprised at the way that this has transpired?
I was partially surprised, but at the same time I was not completely surprised, because in the 8 years of the war, 400,000 motivated Ukrainian men went through the front lines and became Donbass war veterans. They started writing books about this war. They set up their own publishing houses. They became business people. They set up the most popular pizza chain, which is called Veterano Pizza in Ukraine. And they were training. I mean, I knew some of them. I know the founder of this pizza chain place. And he was training, he was saying that he will go back to the front very soon. They were expecting this war more than people who didn't go to the front lines. And all these 400,000 went to defend Ukraine together with others. So, I mean, I was sure about the resistance of these war veterans because, I mean, they became very strongly minded, very patriotic, I mean, properly patriotic Ukrainians who wanted and who were ready to fight and, if necessary, to die for Ukraine.
Yeah. This has been so heartbreaking for me to watch as a Ukrainian, for you to watch millions of people leaving the country, to watch the homes, the hospitals, the churches, everything that's been destroyed. I have a little bit of a crisis of imagination figuring out how this ends, and especially how it ends well. How do you see this ending eventually?
It's quite a difficult thing to talk about, but of course, I mean, it will be ended or put on hold in case of Putin's death. But then you have several groups in the Kremlin who will be fighting to take control. And the only sort of group which can stop the war if they win are the Russian oligarchs, who are losing most of more than anybody else. If the army generals or GRU generals or FSB generals will take control, the war will continue, and then it will be frozen probably, and there will be another temporary deal reached.
Your home is in Kyiv.
Yes.
Can you imagine home ever feeling the same again?
Kyiv, I hope it will survive. In fact, actually, I was writing a novel about 1919 in Kyiv during the civil war after October Revolution of 1917. And it was a similar situation. Bolsheviks came 4 times to Kyiv in order to occupy Ukraine. From the 4th attempt, 4 years later, they managed to do this, and Ukraine became Soviet territory until 1991. We had only one attempt so far to occupy Kyiv, because if you occupy Kyiv, the capital, you control Ukraine.
You've got the whole thing.
I hope there will be no second chance for Russians. But of course, I mean, they are very disappointed. They are looking now for guilty party. I mean, Putin is arresting his own generals and putting them in detention.
I could talk to you all day about this. It's heartbreaking, and yet the resilience of the Ukrainian people is so exemplary to so many of us. Thank you so much. I'm really glad to have you on the program. Andrey Kurkov, the novel is The Great Bees. We'll continue with more on Flashpoint right after this.
Don't miss the Chevrolet Detroit Grand Prix presented by Lear June 3rd through the 5th. This is your last chance to catch the Grand Prix on Belle Isle before the race moves downtown in 2023. Friday is Comerica Bank Free Pre-Day, where it's free admission and access for everyone. Then catch great racing all weekend long, including the IMSA WeatherTech Sports Car Championship on Saturday and the NTT IndyCar Series on Sunday. Visit the Meyer Fan Zone for games and family fun and the new Fountain Fan area for live music. Get tickets at DetroitGP.com or call 866-464-FREE.
Attention Medicare beneficiaries. If you have or are eligible for Medicaid, please listen closely. You may be eligible for a Medicare Advantage plan from WellCare with a zero or low plan premium. Call now. We can answer your questions and help you enroll over the phone. WellCare provides access to essential benefits that go beyond original Medicare, such as dental, vision, hearing, and prescription drug coverage with free home delivery. Plus, extra benefits like free over-the-counter healthcare items, free transportation, free gym membership, and home-delivered meals. Get more access to care with WellCare's telehealth services, including online doctor visits and a 24-hour nurse advice line. WellCare is contracted with Medicare to provide plans that may be perfect for you. Call 1-877-283-2585 now. That's 1-877-283-2585.
When Help Me Hank steps in, expect more uncovering.
How would you like this in your neighborhood?
This community is full of children.
Expect more exposing.
We appreciate the work that you do, Hank, and helping us get this word out.
And expect more results.
Within hours, a crew from the city out here on this scene cleaning up this entire mess.
I thank you tremendously.
You the man.
When Help Me Hank investigates, expect more.
The FDA is considering a phase-out of menthol use in cigarettes, an additive that has had a massive impact on African Americans. I wanted to talk about this for several weeks. So glad to have with me Minu Jones, here to talk about it. She is the founder and CEO of Making It Count Community Development Corporation. Minu, thank you very much for coming.
Thank you for inviting me.
This is a headline that maybe would be really easy to just kind of run right past, but cigarettes and menthol in particular have had an amazing impact, sadly so, on the black community.
Yeah, it's a social justice issue. 45,000 African Americans lose their lives to tobacco-related disease every year. It's the #1 killer of African Americans in the United States. So we applaud FDA. This is an historical moment in the move in the right direction towards advancing health equity.
And it's almost like a stereotype or a cliche joke over the years about jokes about cools. Yeah. But it's all based in truth, because back in the 60s there was a massive push to create more African American smokers.
Yeah. If you think about the Cool Jazz Mix Festival, right? I know you love music. Yep. You know, African Americans, people love music. Yeah. And so that was, purposely designed to lure African Americans into addiction of menthol products, right? We had Miles Davis and Music in the front, sure, and tobacco, Newport, Cools, Winston in the background, selling free products, or not selling, but giving away free products, promo materials. I remember my dad back in the day, he had the little sweatband, and the cuffs, and I would take them and put them on. I thought that they were cool. And I was a kid, right? So.
And it worked amazingly well, because now 85% of the market for menthol cigarettes are African Americans.
Yeah. In the 50s, it was 5%. And today, it's almost exclusively used by African Americans.
That speaks to a pretty effective advertising campaign, doesn't it?
It does. It does.
Now, it's been interesting, because I think some people think, well, this is a no-brainer. Yeah, let's get rid of that. It's also, by the way, I should also include sweetened cigar products and things. It's not just menthol, but anything that kind of hides that smoke that can help people understand that it's dangerous. But it's interesting. You start looking around, you see people like Al Sharpton saying that, wait a minute, let's not get carried away. This is just one more small law that mostly affects African American and mostly African American men. Just one more way for the law to trip them up. Let's be careful before we move down that road. Does he have a point?
Well, the NAACP also endorses this, and American Medical Association. This is, long-term research that has been done, to get to this point for FDA to ban mentholated flavored tobacco products, right? National African American Tobacco Network is funded by Reynolds American in part. So.
Yes, yep, following the money. But we have seen Eric Garner lost his life in New York because he was selling single cigarettes.
So FDA has made it, crystal clear that this is not about targeting smokers or users of mentholated tobacco products or flavored cigars. FDA, enforces retailers and manufacturers.
Manufacturers especially,
so,
right.
Eric Gardner, and all of the other social justice and police brutality issues in the United States. We know racism and police brutality are an issue, but so is menthol. Menthol, to the tobacco companies, they're the #1 killers of African Americans, not the police.
You took me back to the idea of giving them away the way they did. That pusher's first hit's always free, right?
Yeah, I recently learned that Dave Chappelle, he was given free cigarettes at 9 years old.
And goes through them now like a chimney. Yeah. I mean, it's really good to have you here to talk about it. I so appreciate your thoughts on it.
Thank you.
You bet. That's going to do it for us this morning. Thank you so much for being here as well. Meet the Press coming up next. Hope you have a great week, and we'll see you next time right back here for Flashpoint.